Quick facts, page 12, continuing on with the blood. What is the most common infection spread through a blood transfusion? Hepatitis B. In order to determine donor compatibility, you must do a type and cross match. What must be done to determine their baseline before starting? You take the vital signs. IV must be an 18 gauge with a filter needle. Nurses, to confirm the unit of blood, you must have 2. How long after the blood is removed from blood bank's refrigerator do you have to start? 30 minutes to bring it to temperature. How long must you stay with the client after started? 15 minutes. Milliliters in 1 unit of packed RBCs is about 250 milliliters. Signs of an adverse reaction are restlessness, nausea, hives, SOB, fever, chills, back pain. How do you know if you have an adverse reaction? Or what you do if you have one is you stop it right away, run the normal saline that hangs with the blood, do vitals, notify doctor and blood bank, make sure urine and blood cultures are done. You have to run it at a slow rate because running blood fast can cause fluid overload. The drug that's used to treat anemia, which increases the RBCs, epiatin alpha. Clients taking epiatin are monitored for hypertension and seizures. Moving on to page 13, blood pressure. With blood pressure, it's the force of blood flowing through the arteries. Recommended 120 over 80. Systolic and diastolic pressure. Systolic is pressure while heart beats. Diastolic, pressure while heart rests. Diastolic, if the pressure of the heart is elevated at rest, then high blood pressure is present. Common risk factors in African American, obese, anxious, diabetic smokers. Signs that you can have of hypertension are blurry vision, headache, chest pain, but remember that HTN is called a silent killer because most people don't have symptoms. The size cuff that can affect the reading: if it's too small, the BP will be higher than it really is. If it's too big, the BP will be lower than it actually is. Other factors: position, caffeine, anxiety, or activity can affect the blood pressure reading. Pulse pressure is the difference between systolic and diastolic numbers. Moving on to page 14, quick facts. Mean arterial pressure is diastolic pressure plus 1/3 of pulse pressure. This value should be greater than 60. Before you give a blood pressure medication, always check blood pressure and pulse rate. Hold the medication if systolic BP is less than 100 or the heart rate's less than 60. Classes of meds for HTN are diuretics, beta blockers, calcium channel blockers, and vasodilators. Medications that end in pril are ACE inhibitors. ACE inhibitors correct heart failure by decreasing. They also promote vasodilation by inhibiting the production of angiotensin. Angioedema is the adverse reaction seen with the use of ACE inhibitors. Signs of angioedema are swelling of the lips and the mouth. Clients may have persistent nagging cough. So, what's moving on page 15 is which is more dangerous than angioedema, a cough or of the lips and the mouth. Swelling of the lips and swelling of the mouth may indicate laryngeal angioedema. A compromised airway is the priority. Medications that end in OLOL are beta blockers. Clients who take hypertensive medication should be taught with what method to avoid falling. Sit in a chair or at a bedside for 30 minutes after taking medication to adjust a lower circulating blood pressure. Herbal medication used to lower BP, garlic. Clients taking antihypertensive should avoid hot showers, baths, and hot weather, because these things can cause dizziness. Best diet for HTN is low sodium, low fat DASH diet. Breastfeeding moms will often feel abdominal cramps while feeding the baby. This is due to the release of prolactin and oxytocin. The best way to burp a baby is while she is sitting up. Benefits of breastfeeding include passive immunity, quicker weight loss in mother after birth, increase in bonding, economically low cost to breastfeed versus buying formula. Page 16, Berger's disease, thromboangitis, obliterans. This disease is the obstruction of inflammation of blood vessels, mainly where? Hands and feet. Client present with what symptoms? Pale, blue, cold hands and feet. They may tingle or be painful. Who is at most risk for this disease? For the Berger's disease, males who smoke or chew tobacco are at most risk. Treatment goals are there's no cure, only symptom control. Teach client to stop smoking, dress appropriately for the weather, and try to reduce life stressors. Bulimia nervosa. What is the eating cycle involved? Eating binges followed by purges. Physical changes or weight loss. Client usually remains at normal weight with other methods of purging that the bulimic use are vomiting, edema, drugs, speed, diuretics, diets, and pills. Medical complications associated with bulimia nervosa are tooth decay, electrolyte imbalances, ulcers, cardiac arrhythmias. Safety is a concern because clients with bulimia nervosa have suicidal thought. Moving on to page 17, lists the treatment goals with bulimia nervosa. Would be encouraging talking, safety, and assessing suicidal potential, establishing a diet plan, supervision during mealtime, and antidepressants may also be prescribed. Burns. What are the two age groups most at risk for suffering a burn injury? Children and elderly are at most risk. 4 types of burns are chemical, electrical, thermal, and radiation. If the face, neck has been burned, what is the nursing priority? Airway obstruction. You use what rule to estimate the body surface area that's burned is the rule of 9s. What is each burn percent in adults? Head would be 9%, 4.5% for the front, 4.5% for the back. Chest and upper back, 18%, 9 each front, and 9 for the back. Abdomen, lower back, 18%, 9 front, 9 back. Each arm is 9% front and back, so 9 front, 9 back. Each leg, 9% front, 18% for the front and the back. Each palm is 1%, and the genitals are 1%. This completes page 17 of Quick Facts.